So right now, I think our latest numbers just today, we had 78 new cases that were identified. That brings our total case count in Dallas County to 247, and we've had our 6th death. Now, one of the things, and we're early in this outbreak. What's been concerning in particular with this is how we've seen how fast it spread, how it overwhelmed some of the healthcare systems in China, in South Korea, in Italy. Now we're seeing on the West Coast and East Coast some of those numbers that are very concerning. We've done just, some of the math regarding the potential for this, and to see how, there's two populations in particular, two issues that we're really trying to address with this. We're trying to protect some of the vulnerable population, some of the older population, those with chronic health conditions of any age. Also protect healthcare workers and our whole healthcare system from being overrun. Because then if the healthcare system becomes overrun, we can't even take care of all, whether people from COVID-19 or any other healthcare conditions that will be going on. So, if you do the math, and so, currently the judge has issued some orders on social distancing, stay home, stay safe type of policy. The goal of that is to slow this down, to keep the spread of the infection manageable. If we keep, say, the prevalence of this so that only 2%, the goal of it is really to keep the prevalence down to something like 2% of the population being infected. If we do that, then if you just do the straight math, there's about 2.5 million population in Dallas County. 2% of it would be about 58,000 or 51,000 persons having infection. We know some of the case fatality rates for the different age groups, and based on our Dallas County population, if we kept it down to 2%, about 681 deaths would occur. But we also know then, in terms of the number of hospital beds that we have in the area and the number of ICU beds we have, it's about almost 4,000, say, non-ICU beds, another 400 something ICU beds. Now, if you just do the straight math, I said previously, if you get 2% prevalence, 51,000 Dallas County residents would be infected. And if we say those are the persons infected, 7%, that's pretty conservative compared to some of the estimates, can be up to 15% needing hospitalization. You multiply 7% times 51,000 persons infected, you'd have about a little less than 4,000 persons that need hospitalization. And that's manageable within our system. But the problem is, and this is where the concern, if you get, and 2% is keeping it pretty low, as you can imagine, where only 2% of people get COVID-19. If you raise it then, instead to say 20%, so 20% of the people in Dallas County get infection. That means 517,000 out of our 2.5 million have infection. Do the case fatality rates, you'd get about 6,800 deaths. In terms of the number of hospital beds that would be needed, it'd be like 37,000 beds compared to the 4,000 that we currently have. So this is, thinking of the magnitude of our healthcare system, we've got about 4,000 beds available. We're down about 33,000 beds. And you can see how that can potentially influence and impact our healthcare system. And that's only with a 20% prevalence. That's, some of the estimates are that certainly if you don't do anything, this can get even to 70% of the population being infected. So this is why it is so important to be acting quickly and to be acting very strongly on trying to do these social distancing efforts and keep and slow down the spread of this infection.